Hi, I'm Blaine, family physician in Stratford, Ontario. As the summer draws to a close, anxiety is riding high as the school year approaches. But the worrying is worse than what the reality will be. So let's see if we can turn some of that anxiety into confidence. Let's talk about the many ways that parents and caregivers can help their children in the transition to this new school reality. Get to know your children's school policies and procedures, and talk to your kids about the changes they're going to see at school this year. We owe it to our kids to be kind and patient with school staff and educators. Yes, I write like a doctor. They are navigating massive change, and they're doing their very best. They need our help, and we'll get through this together. Let's also remember that we owe it to our kids to remain calm during this whole process and not let our own anxieties derail them and their successes. Most school-age kids can and should wear a mask. Thankfully, face coverings have become the norm. Show them that you're comfortable wearing one. Ease into it. With younger kids, you can use toys or stuffed animals or pictures. Praise them, but no sharing. Make sure to label your kids' masks and to wash them regularly. Make sure your kids know where extra masks are and what to do with a mask that's no longer being used. Review the proper technique and timing of hand washing. Physical distancing is important. It's okay to politely ask someone to give you a little bit more space. We can still socialize while maintaining an appropriate distance. People have different preferences, so let's respect the comfort zones of others. Do not send children to school who are ill. It is impossible to tell the difference between a mild cold, the flu, or COVID-19 based on symptoms alone. Keep them home and follow public health guidelines. You can also use the online self-assessment tool at covid19.ontario.ca to determine whether you or your child need to be tested for COVID-19 or to see a healthcare provider. Most kids with well-controlled asthma or chronic respiratory disease should be able to attend school and are unlikely to develop significant symptoms from COVID-19. However, some kids with asthma and certain severe illnesses may be more affected by a COVID-19 infection. They should stay home. Talk to your family doctor or specialist to know for sure. Asymptomatic transmission by young adults is now recognized as a key method of spread for the virus. But the exact role that children play in the transmission of COVID-19 is not certain. That's why it's very important to follow public health and school procedures carefully. It's safe to say that we will see cases rise as we move into the fall. But public health will be monitoring the prevalence of COVID-19 in the community and will be working with school boards to make the best decisions possible with the information we have. A few final thoughts. Please get a flu shot for everyone in your family. It has never been more important to take advantage of this crucially important and effective preventative tool. If possible, please consider downloading the COVID Alert app. This voluntary tool can help you and your family, the community, and assist with contact tracing. Let's be positive and work through this together, supporting one another through this transition. Talk this through as a family. This is indeed a unique and historic time, and we will rise to it. Get familiar with the many resources in your community: provincial websites, local health unit, your health clinic. Follow your school, the school board, the public health unit, and your family physician on social media. Over the last 6 months, there is one definite certainty we can count on. As our knowledge of COVID-19 grows, the rules and the recommendations are going to change, but we will learn and go through this together. Stay safe, everyone, and have a great start to the school year.